Welcome, everybody. My name is Craig Leday. I'm one of the managing principals at ICG Next. On behalf of Michael Bonavento and James Costabile, we want to welcome you all today to another presentation. This one is on Medicare supplemental plans from a good friend, Lou Tumulo. I've known Lou for probably my entire career, 34 years. Lou has been in the financial services industry as a financial professional for over 40 years. As I shared with you earlier, I've known Lou for my entire career. He's been out there as a supporting advisors and helping us increase our knowledge and increase our effectiveness on delivering solutions in regards to clients' specific situations. What brings Lou to Medicare supplemental is Lou actually had a less than positive experience when he started searching for Medicare supplemental. And he made a decision at that point in time, not only to get his situation straightened out, but to become a resource to financial advisors so that we can make the transition smoother and easier for our clients. So with that, I'd like to introduce Lou Tumulo.
Thank you, Craig. Hello, everyone. Good afternoon. I hope you are having a fantastic day. One of the comments I like to make, first and foremost, I appreciate Craig and Deb and their support, and Ira and the whole team at ICG Next, and allowing me the opportunity to share this information and this knowledge with you. As Craig mentioned, there's a lot of information. It can be somewhat confusing and complex. And should you be in a position where you need a one-on-one consultation, I am happy to work with you and your financial advisor, and we could do a Zoom, or if need be, if you prefer, I can visit the office and we can sit socially distanced in one of the beautiful conference rooms at ICG Next and look at your specific situation. Is that fair? Everybody good with that?
Sounds good.
Okay, so Deb, can I start sharing my screen now?
Yes, you may.
All right, I'm going to put a, where is it? Right here. I'll put a PowerPoint presentation up, but as Craig mentioned, if you can, please try to hold your questions until the end so that we can get through all of this. And when you ask your question, even at the end, if it's something that I feel is more personal and relevant to your specific situation, I'll just ask you if we could maybe take that offline, if that's okay with everyone. Fair?
Fair.
Oh, everyone's muted, so good. Okay, so this always happens. Let me just move everyone's picture here. So we're going to talk about what we call original Medicare first. All right. Original Medicare consists of two parts, which I'm sure everyone is aware of, Part A and Part B. Part A coverage is your hospital insurance. And when you think of Part A, think of Part A as the building, the bed, and as I like to say, the bad Jell-O. Although anytime I've ever visited anyone in a hospital, I've always eaten their Jell-O, and then they ask me to leave. With Part B, think of Part B as the people, the doctors, the nurses, and any other medical professionals who are involved in your care while you're being taken care of in the hospital or even outside of the hospital. Now, what we need to know is that there are certain out-of-pocket expenses that exist in original Medicare Part A and B coverage. And we're going to talk about those here. So with Part A coverage, again, this is your hospital insurance plan. It pays for inpatient hospital care, it pays for hospice care, and it pays for some skilled nursing care and some home health care. Now, there are certain deductibles and costs that go along with Part A Medicare coverage. What you need to know as well is that once you go on Medicare, you will not pay a premium for your Part A coverage because you've paid that premium for Part A while you were working, or if you didn't work, maybe while your spouse was working. However, with Part A, you do have a deductible. That deductible for the year 2021 is $1,484, and there is no co-insurance for days 1 through 60 of each benefit period. So you pay that initial $1,484 deductible, and that's it. If you happen to be hospitalized for longer than 60 days, for days 61 through 90, you are responsible, you and I and everyone else are responsible for $371 per day of each benefit period for 61 through 90. If by chance you happen to be hospitalized for longer than 90 days, your portion increases from 371, as you can see here, to 742, because you have 60 what they call lifetime reserve days. So after day 90, your share of that hospital cost increases to $742 per day. After you've used up all of your 60 lifetime reserve days, you are then responsible for all costs beyond that. Now, I hope there isn't anyone on the call that's getting a little nervous now looking at these numbers and these costs, because I'm gonna show you how to save yourself in a couple of minutes. I'm just sharing with you what the Part A coverage is, what the costs are. Now we'll talk about your Medicare Part B coverage. So there is a monthly premium. When you go on to Medicare, there is a monthly premium that you will pay for your Part B coverage. And again, Part B coverage pays for doctor services, outpatient hospital services, medical services, and supplies. In another minute or so, I'm going to show you exactly what is covered and what is not covered in Medicare. But the base monthly premium that you will pay with your Part B coverage is $148.50. Additionally, there is an annual deductible with your Part B Medicare coverage of $203. So before Part B pays anything, you have to pay the $203 out of your pocket. And no matter what you do, there's no way to get around that. Now, here's where it gets a little disconcerting for a lot of folks. Medicare typically only covers 80% of your costs. So if, and I always say, God forbid, if God forbid you go into the hospital with an illness and you're in there for, I don't know if it's 30, 60 days, whatever it might be, and the bill comes in, and let's say the bill is $250,000, because those bills run up pretty quickly. Medicare is going to pay 80% of that, okay, which will amount to 80% of 250 should be $200,000, correct? My math good? That means you and I are on the hook for the additional $50,000. And if you go into the hospital again and you're in for another extended period of time, that same 20% cost sharing exists for you again. So this generally comes as a bit of a shock to people, because they think, well, I go on Medicare, everything is covered. And unfortunately, the Medicare Trust Fund is actually in trouble anyway. The government is working on strategies to hopefully resolve that, one of which is to potentially lower the age to be covered by Medicare to age 60. You might think, well, why would they want more people in? And then the reason is because they'd have more people paying that monthly premium for the Part B coverage, right? So that's your Part A and Part B. By the way, that $148.50 that you pay, that's your base premium. Depending on your income just prior to going on going on Medicare, that premium can be higher. And I have a chart later on that will show you how high that premium for Part B coverage can go. But if you turn 65, and by the way, when you turn 65, you must enroll in Medicare Part A. If you're still working, if you're still employed and covered by group health insurance coverage, you do not need to, and you should not enroll in Part B coverage. All right. And there's a reason for that, which I'll talk about in a couple of minutes, but just keep that thought in mind. If you're working past 65 and you are covered by what the government refers to as creditable group coverage, you do not have to enroll in Part B, but you must enroll in Part A. However, remember, there's no cost to Part A, and you can do it all online. You can either go down to the Social Security office or you can do it online. That choice is yours. All of my clients do it online. It's easy, it's simple, and it's a fairly streamlined process, albeit that the government can be kind of slow. So I recommend that at least 45 to 60 days before your 65th birthday, that you start the process of enrolling in your Part A Medicare coverage. Now, if you are covered with a group health insurance plan, as I explained, because you're working beyond age 65, Medicare's not going to pay anything, but just understand that you have to enroll in Part A. So let's take a look at some of what is covered by Medicare. The doctor services that are covered are services that are received in the hospital, in the doctor's office, from your doctor's nurse, in any Medicare-approved medical or nursing facility, at home, assistant surgeon fees, diagnostic tests and treatment, administration of Part D drugs, that's your Part D prescription drug plan, which we'll talk about in a minute, and aesthetic fees. And you get a welcome to Medicare preventative visit when you initially go on Medicare. And then you receive a yearly wellness visit every 12 months. Outpatient services that are covered. And by the way, if I'm speaking too quickly, just let us know. I'll slow my pace down for you. Emergency room is covered. Hospital clinic services are covered. Physical therapy, administered drugs, lab tests, x-rays, radiology, medical supplies. Medical services and supplies that are covered are independent lab tests, blood work, etc. Ambulance. This is one you need to be cautious about because the Medicare reserves the right to come back after you've used an ambulance. If they review the file and determine that you didn't absolutely need that ambulance ride to the hospital, if it wasn't medically necessary, they will come back and bill you for that. Surgical dressings, any casts and splints, pacemakers, artificial limbs, braces, wheelchairs, and other necessary equipment are all covered by Medicare. Corrective lenses after a cataract operation, and then your oxygen supplies and equipment. All this is what's covered by Medicare. Generally speaking, what we say is Medicare does not cover anything from the neck up. So teeth, eyes, and hearing are not covered under Medicare, unless you use a Medicare Advantage plan, which again, we're going to talk about in just a couple of minutes. So here's what's not covered. Dental care, as I just mentioned. Oral surgery is not covered. Routine foot care, eye or ear examinations. If you are diabetic, then they will cover your foot care, your routine foot, your foot, you can go to a podiatrist. But otherwise, if you generally go to have calluses removed or your toenails clipped or whatever it might be, they're not going to pay for it. Chiropractic services, except for manual manipulation of the spine. And I'm trying to figure out exactly what manual manipulation of the spine is. As soon as I find out, I'll let everyone know. But chiropractic services are not covered unless there's manual manipulation of the spine. Cosmetic procedures that are not medically necessary are not covered. So If you decide one day that you want a facelift, you want to get some of the wrinkles taken out of your chin, or you want a new nose, you're going to have to write that check yourself. However, if you're crossing the street and unfortunately you trip and fall and smash your nose and they need to repair it, and they happen to give you a new nose, a prettier nose as a result of that, then yes, it would be covered. Lab tests that are not medically necessary are not covered. Dental plates, orthopedic shoes, first aid supplies, self-administered drugs, even with a doctor's prescription, are not covered. So self-administered drugs, even with a doctor's prescription, might be insulin. All right, that's not covered under Medicare, although that is covered under your Part D prescription drug coverage. So that kind of confuses people sometimes. Eyeglasses, not covered. Hearing aids, not covered. So there are two ways to experience Medicare. There is original Medicare, which we've just gone through, where your Part A coverage is free. Your Part B coverage, there is a premium attached to that. And the base premium, depending on your income, for the previous 2 years prior to going on Medicare, the base premium is $148.50. Then you have an option of selecting a Medicare supplement plan. That Medicare supplement plan effectively will cover all that 20% that I mentioned earlier that is our responsibility. So if you have original Medicare and then you purchase a Medicare supplement plan, which is sometimes referred to as a Medigap policy, generally speaking, you will never see a doctor's bill. Everything will be taken care of. Now, one of the reasons you don't enroll in Part B if you're still covered under a group health insurance plan, if you're working beyond 65, is because when you enroll in Part B coverage, you get what's referred to as guaranteed initial enrollment, which simply means that regardless of your pre-existing conditions and your current health situation, the Medigap company, the Medicare supplement company, cannot by federal law refuse you. So I've had people that they're seriously ill, but they were working and covered by a group health insurance plan. And then they go on to Medicare and pick up a Medigap or Medicare supplement policy, and they get the same coverage that you and I would get. All right. If you get beyond 6 months of your Part B enrollment, which is why I said, if you're still covered by a group health insurance plan, you do not need to enroll in Part B. Don't listen to what I'm sorry, does someone have a question? No? Please don't listen to what your friends at the country club or your social club or your neighbors tell you. I had one couple who had enrolled in Part A and they were told to enroll in Part B. They had retired at 65, but they then moved to Wildwood, New Jersey, and decided to work at the local Acme supermarket and became members of the union and received group health insurance as a result of their employment. But they were told to enroll in Part B. So for 5 years, this husband and wife paid that Part B premium and received no benefit for it. Their total cost for the premium over that 5 years, which is out of pocket, amounted to nearly $20,000 over 5 years. And the challenge is that when you have group health insurance in that type of situation, and then you have Medicare, Part A, Part B, and a supplement, Medicare is secondary to your group health insurance. And when Medicare is secondary, they pay $0. So please don't listen to anyone. If you ever have a question, contact your advisor, have them contact me. I'm happy to walk you through it. So it's important that unless you're actually retiring and you desire to go on Medicare, and you're losing your group health insurance coverage, that you do not enroll in Part B until that time. Now, Part D is your prescription drug plan, and that premium will range typically between $17 a month and $50 per month. That's not your total cost. That's just the premium for your Part D prescription drug plan. In addition to that premium, you will have some out-of-pocket costs for your medications, depending on what medications you're on. They rank it in terms of tiers. There's tier 1, where there's generally no copay for it. Tier 2, maybe a small copay. When you get to tier 3 and tier 4, medications like Eliquis or things of that nature, there will be a copay for that. I have a gentleman who's on, I think, 9 or 10 different medications, and his out-of-pocket cost for his Part D prescription drug coverage is going to be about roughly $3,000 or $3,500 a year, in addition to the $12 a month premium that he's paying. Now, the caveat is that with your Part D prescription drug coverage, you need to review that every year. October 15th to December 7th is what's referred to as open enrollment or annual enrollment. Every year on October 15th, the 30 or so companies that offer a Part D prescription drug plan change what's called their formulary. And that formulary for each company is what determines what medications they will cover and how much they will cover. So it's important that you review that. We offer that service as there's no cost to that. We'll connect with you every year between October 15th and December 7th. We'll walk through what medications you're on, if anything has changed, if you've added new medications, and then we'll tell you what the least expensive option is for that prescription drug plan. There's no cost, there's no fee, there's no obligation. We just do it as a service to our clients. What's important to know is that any doctor that accepts Medicare must, by federal law, accept your Medicare supplement plan. And when you have original Medicare and a Medigap or Medicare supplement plan, you can travel anywhere in the country and receive medical care. Any doctor that accepts Medicare must, by federal law, accept your Medicare supplement or Medigap policy. So you're protected. Even if you travel internationally, you have coverage up to, I believe it's $80,000 this year. Now, if you're going to travel internationally, you're going to be there extensively. My recommendation to clients is that they purchase a separate travel insurance policy just to protect themselves. Some folks are going to go to just travel Europe when they retire. They're going to be there for 30 or 60 or maybe 90 days. Maybe they have family there. My recommendation is, again, purchase a separate policy and keep yourself protected. But if you're going for 7 to 10 days or 2 weeks, something of that nature, you're fine with original Medicare and your Medigap policy. So if you're looking at costs, your Part A is free. Your Part B is $148.50. On average, your Medigap policy will run, depending on your zip code, about $150 per month, plus or minus a few dollars. Okay. Now, what I can promise you is that over time, that Part B premium is going to go up. Last year, the Part B premium was $145. This year, it went up to $148.50. Your Medicare supplement or Medigap policy may increase a little bit each year as well. And then your Part D prescription drug plan is going to change every year anyway. And we'll always try to get you the lowest possible option for you based on your medications. In some cases, it may not make sense for you to change your Part D plan. But there have been situations where we've saved people nearly $3,000 per year in their Part D prescription drug coverage, because they came to us and they never reviewed their options with the Part D drug plan. So if you let it go for a couple of years, it could be pretty impactful to you. Now, again, with original Medicare and your supplement, no matter where you travel in the country, you have coverage. You can see any doctor that accepts Medicare. The other option is what's called Medicare Advantage, or sometimes referred to as Medicare Part C. With Medicare Part C, there are some moving pieces, moving targets here. Your premium for Medicare Part C is in some cases going to be zero. So where you pay a $150 or $160 a month premium for your Medicare supplement plan, you may pay zero for your Medicare Advantage plan. However, here are the differences, and these are critical. Medicare Advantage is an HMO or PPO structure. So you have to stay in the network. If you have a doctor, whether it's a primary care physician or whether it's a specialist that you see, and they are not in the network or in a network, then you would have to change physicians, or you would have to pay for that out of pocket. In addition, with Medicare Advantage, and there are lots of different Medicare Advantage plans, but generally, every time you see the doctor, you have to pay a copay. If you want to see a specialist, you need to get a referral. Whereas with original Medicare and a supplement plan, you don't need a referral. You can see any doctor anywhere at any time who accepts Medicare, and most doctors accept Medicare. They have to, because otherwise they lose a lot of patients. So Medicare Advantage, it's an HMO or PPO. So if you're retiring and you live in New Jersey or you live in Pennsylvania and you think you're going to spend 2 or 3 months in Florida as a result of retiring, that's wonderful, except that you may not have coverage if you opt for Medicare Advantage. Additionally, again, you have the copays to deal with. You need the referrals to see the specialists, and you're actually on the hook for up to $7,200 per year in out-of-pocket costs with Medicare Advantage. Whereas with original Medicare and a supplement, you don't have that out-of-pocket cost. You pay the premium, but you don't have the out-of-pocket costs. You don't have the copays, et cetera. Now, with Medicare Advantage, you don't have any medical underwriting. Here's something that's really important for you to understand as well. I have folks who say, well, you know what, I want to go with the less expensive route. And that's wonderful. That's your decision. As long as you understand the ramifications and the differences between the two, which we work really hard to make sure you understand those. Once you go to Medicare Advantage, let's assume you get 2 or 3 years down the road, and now you're saying, well, gee, I'm coming out of pocket with a lot of money now with Medicare Advantage. I'm not paying a premium, but I'm paying all these other fees and expenses. I want to go back to original Medicare and get a Medigap policy. Unfortunately, you can't go back to original Medicare with a Medigap policy or a supplement plan unless you go through medical underwriting at that time. Remember, once you get past that initial 6 months, you have to be medically underwritten from your Part B enrollment. What I counsel clients on is, if you can do it, if it's financially viable for you, go into original Medicare with a supplement plan. If you get 3 or 4 or 5 years down the road and you find that financially it's just not viable, you can't do it any longer, you can always go from original Medicare with a supplement plan to Medicare Advantage with no medical underwriting requirement. And you can also go from Medicare Advantage plan to Medicare Advantage plan with no medical underwriting at any time. You just have to make sure you do it at certain times of the year, generally during that annual enrollment period. You can change plans. All right. I think that's pretty much, I covered as much as I can cover on that. So here's something else that you need to understand. The premiums for your Medicare supplement, for your Medigap policy, are different for every company. So I typically try to work with the bigger companies. I have access to 12 to 15 different companies, depending on what state you live in, depending on your zip code. Not every company writes in every state and in every zip code, believe it or not. But the actual Medicare supplement plans are all identical. So don't let anyone tell you ever that the Aetna Medicare supplement plan is better than the United Healthcare plan, which is actually the AARP plan. Because if they tell you that, they're not being honest and truthful with you. Every plan by federal law must be identical. What's different is the premium that each company will charge you. And that premium is a function of the zip code, the state and the zip code in which you live, and healthcare costs in that zip code specifically. And then the claims experience of that company relative to their underlying pool of insurance. The differences are not generally dramatic. The difference between an Aetna and a Humana or a United Healthcare might be $10 a month. So in that case, it really boils down to who you feel most comfortable with. But just know that if you get the F plan supplement or the G plan supplement, that plan will be identical across every company. Only the premium will vary. Right now, unless you turned 65 prior to January 1st of 2020, you cannot purchase the F plan. The F plan was always referred to as the Cadillac of Medigap policies or Medicare supplement plans. And the only difference between the F plan and the G plan is that the F plan actually covers, as you can see here, I think it covers that Part B deductible of $203. Even when I have clients who are eligible for the F plan, I counsel them as best I can that they should just opt for the G plan. And here's why. Again, the only difference between the F plan and the G plan is that $203 deductible that the F plan covers, the Part B deductible. However, the difference in premium, believe it or not, between an F plan and a G plan, and this is pretty much across all companies, the difference in premium could be $30, $40, even $50 a month. So why would you pick $40 a month as a difference? Why would you spend $480 a year just because they're going to pay that $203 deductible? Just makes no sense. And the fact that they're not allowing anyone in any longer, if you didn't turn 65 prior to January of 2020, means that you don't have any new younger people coming into that plan. And so what you're left with are folks like me that are moving along in age. And as we, generally speaking, as we go further along in age, we generally start to utilize the services more, which means the company is paying more, which in turn will drive the premiums up. So my recommendation is go with the G plan. Unless you really want, we call it meta bragging. Some people like to meta brag. Well, I have the best plan possible. All right. If you want the best plan possible and you want to pay extra for no reason, I can't stop you, although I would try my best. The other plan that's available currently is the N plan. The N plan has a deductible. It has additional costs for co-pays and so forth that are available. And again, we could get into the specifics of these if it's warranted with your individual situation. But I just wanted to give you a picture of what it looks like and what's covered. We talked about changing your Part D plan every year or looking to change it, review it based on your medications and any changes to those medications. This is what your Medicare card should look like. It will have your effective date for your Part A and your effective date for your Part B. If you're retiring at 65 and you're going on Medicare, those effective dates will be the same. But if you turn 65 this year, but you're not retiring for 2 more years, your Part B effective date will reflect that date 2 years from now. So this is the chart that shows you what the cost differences are based on your income. I have to move this. So if you file an individual tax return and your income, that says 2016, 18, I needed to change that. That should say 2019. But the income thresholds are 88,000 or less if you're filing individual tax return. If it's 176,000 or less, if you're filing a joint return, or again, 88,000 or less if you file married and separate tax returns, your premium is $148.50. If your income, and these are what's called cliff brackets. So if you're $1 over that 88,000, you automatically go to the next level. If you're filing an individual tax return, if you're 88,000 and $1, your base premium for your Part B coverage would be $207. Same thing if it's $1 over $111,000, your base premium goes up to $297. So, and every year this has been changing. As I said, last year, the base premium was only $145. This year it went up to $148.50. I guarantee you next year it will go up as they start to feel the impact of COVID-19. Believe it or not, they haven't seen that. They're starting to see it now because last year a lot of folks didn't even utilize their Medicare coverage because they just, anything that could be postponed or avoided was postponed and avoided due to COVID-19.